If you are considering knee replacement, there are 5 things that you must know before you undergo the surgery. The first thing is that you only should have knee replacement when you have bone on bone. If you don't have bone on bone, the results of your knee replacement will usually not be good. You can easily know whether you have bone on a standing radiograph, that you need of course before undergoing the knee surgery. If there is no bone on bone, as in this case, it means that the cartilage gliding layer between the bones is still present, at least in part, and you should focus on strengthening your cartilage with exercise therapy. And if you wish, with cartilage reinforcing supplements or other modalities such as bracing or injection therapy. Now, in case you have bone on bone, the bone on bone may be located on one compartment of the knee only. We call this unicompartmental bone on bone, like in this case, where it is located on the medial or inner compartment only, or as in this case, where it is located on the lateral or outer compartment only. Or it can be on both compartments, like in this case, and usually one compartment is then somewhat more pronounced bone on bone than the other. So this brings us to point number 2. If you have unicompartmental bone on bone, you should have unicompartmental replacement and not full knee replacement. The reason is that clinical studies have shown that the results of unicompartmental replacement are better than those of full or total knee replacement. So this patient on the left with unicompartmental bone on the medial side should have unicompartmental replacement of the medial side. The patient in the middle with unicompartmental bone on the lateral side should have unicompartmental replacement on the lateral side. The patient on the right with bone on bone in both compartments should undergo full or also called total knee replacement. So it is important to know where there is bone on bone, because if you can have unicompartmental knee replacements, the result will be better than with full knee replacement. The knee will feel then more normal to you afterwards, it will have better functionality, and also will have better kinematics than with total knee replacement. Point number 3. You need to realize that about 15% of the patients that undergo total knee replacement are not fully satisfied after the procedure because they have some persistent discomfort. This can be caused by scar tissue or by a reaction of the body to the prosthesis or because of some other reason. I have made a short video on this, of which I will show you the link at the end of this presentation. Point number 4. The specifics of the prosthesis that you will get are less important. There exist indeed several options on which your surgeon will decide. For example, on the decision whether the prosthesis accommodates retention or substitution of the cruciate ligaments. Numerous clinical studies have shown that this makes little difference. A number of studies suggest that the ACL plus PCL substituting prosthesis show better flexion and better kinematics, but some surgeons could debate this. Also, the option of fixation with or without cement makes little or no difference. And also the material of the prosthesis makes no difference. Except when you have metal or nickel allergy, then you should have a prosthesis out of titanium and even better out of toxinium, because there exists no or almost no allergy to this. Then the last point. Should you have the surgery with a robot or not? If you are undergoing unicompartmental knee replacement, the answer is yes. Clinical studies have shown that the results are better when unicompartmental knee replacement is performed with a surgical robot than when it is performed without surgical robot. For total knee replacement, this cannot be said, at least not today as we speak, and this video was recorded in April 2022. So far, the clinical studies indeed show no difference between total knee replacements that were performed with or without surgical robot. This may change in the future, and I expect it to change in favor of robots, but as today, there is no proven benefit for total knee replacement. So to summarize, the 5 things you really need to know before undergoing knee replacement surgery. Number 1, you should only undergo the surgery when there is bone on bone. Number 2, when you have bone on bone in only one compartment of the knee, you are better off with unicompartmental than with full knee replacement. Number 3, you need to know that about 15% of patients that undergo total knee replacement will remain somewhat unsatisfied afterwards. Number 4, the technical specificities of the implant are less important. Except when you have nickel or metal allergy, then oxinium is the right choice to make. And number 5, you should have robot surgery in case you are undergoing unicompartmental knee replacement. For full knee replacement, the clinical studies so far have not shown a difference in outcome, but this may change as the robots get better. Thank you for watching. I wish you the